Okay, so this video is going to be about sterile technique in general. Things you want to pay attention to when you're trying to open things sterilely, place things sterilely. This is very important from an infectious standpoint. If you're not doing it properly, you could be then laying bacteria onto substances or onto surfaces that we believe are sterile that then are not and will affect the sterility of the procedure that we're doing. The first thing to think about is everything that's packaged sterile will say it on the package. Sterile towel drape, sterile gloves, even the blades say sterile. If it's sterile as it's packaged, that means that everything inside there is sterile. And if you want to keep it sterile, you have to open it specific ways. The things that we sterilize in our packages, you've seen, they come and you know they're sterilized by the way the sterilization indicators show the bars and show you that it was sterilized. Then that means everything inside the package is sterile. That's important. If it is sterile, it'll say it on the packaging on an already prepackaged product. If it doesn't say it, it's not sterile. And so that's important. Let's do how we put down these sterile drapes onto a cart when you're trying to create a sterile field for your surgical instrumentation. You want to open these from the top. They're made with a peel to open. And then what you do is you want to open them out, and I've not touched anything on the inside of that package yet. I've just touched the outer edges. And then these drapes are actually made that they've got a little lip on them. If you look, they have kind of a two-surface. I don't know if you can see that, but they have this little lip. And what you want to do is you want to only touch that on one side. The whole thing is sterile. And notice that I'm only touching this one side of that lip. And so that side that's facing you, I haven't touched at all. The only thing on this I've touched is that little flap that was like that. Now I can lay this down, and everything on the top side of that is sterile. Does that make sense? If you grab it out of the thing and touch this side, then now I've put bacteria from my hands onto the top of that, and I could theoretically contaminate something that we then put on this. Because we don't really know where you touched it. If you touched it here, you certainly didn't want to touch it here. But if you did it like we did it the first time and just do the inside lip of that, it's made so that that lip is something you can handle and not be contacting any surface that is then facing up. So that's how you open the drapes, and that kept it sterile. All instrumentation, same as you've been taught, package sterile. If I'll peel it out, never touching the inside, then that blade is still sterile. It never touched anything but sterile surfaces, and now it's sterile sitting on the sterile field. For the Mohs packaging or prepackaged instrumentation, very similar. It's sterilized as it sits, so everything on the inside is sterile. And so they're made so that you can then open them up. You can place that down on a surface. And then what you want to do is try to only touch the very inner aspects of these surfaces and fold them out slowly. Now I am touching, it's a little different than the white drape that was packaged sterilely. There is no folded edge. So I touched the corners of these, but they're actually made so that they're long enough to hang down and be out of your way so that the chance of any contamination of the actual surfaces that we might interact with is minimal to none. So prepackaged ones, just the tips, and they're made to fold down and pull down and stay where they are. And then this surface is sterile. Everything that was in it was sterile, and whatever you open onto it sterilely will be sterile. Now gloves, if you're putting on sterile gloves, you want to interact with things in this surface and still be sterile. There's a technique for putting these on and staying sterile. Same opening for almost all sterile packaging. They'll be made to peel. And so you can peel those up, down, open. And they're actually made that way so that if you wanted to place them onto the sterile field, that could be done sterilely. I never touched the inside of that And now those gloves are on that sterile field sterile. We don't necessarily do that, but they're made to be done that way. If we want to just put them on in a non-sterile environment but keep the gloves sterile, then you want to do this. They're actually, again, made specific ways. And so what you want to do is take these folds and open them up. I'm not touching the gloves. I actually want to push that down so that they don't fold back over. That's important. I touched all of this stuff. And so if you, in your opening of it, touch these things and then do this and it folds back, then what I touched here might be touching the glove. And that's what you don't want. Or what I touched up here might be touching the glove. That's a non-sterile surface touching a sterile surface. So it's important that you do it like I showed you. Unfold it, lay it out, and flatten it out so that it doesn't flap back. And now that's all sterile. And then sterile gloves are made to be put on. They're sitting on the table in anatomic position. This is anatomic position. So this is ventral, front, that's my back. Anatomic position. The gloves are put on there just like that. So now we're going to put these gloves on. What you want to do is you want to touch only the cuffed area. I don't know if you can see that, but all the gloves are laying on anatomic position like we just talked about, and there's a cuff. So I want to take, in my hand, an anatomic position is going to slide right into these gloves. I want to touch as low down on the cuff as I can. I don't want to try to grab up here because I might inadvertently touch one of the sterile surfaces. I want to touch as far down as I can, and then I can slide this hand in. Goes right in. And the only part I've touched is as far away from my sterile surfaces as I could get. And that hand is sterile down to the cuff. And then with the other hand, it'll also go on in anatomic position. You now have a sterile instrument you can utilize, your other hand. So this one you can pick up, and you can pick up by the cuff. And notice that my sterile hand is touching inside the sterile portion of the glove. Everything sterile is touching something sterile. The inside of the glove that I'm going to put on with my left hand, I'll slide in an anatomic position, pull down. You want to make sure that you're never touching your unsterile arm. And now, same thing. This hand is fully sterile down to the cuff for sure. This one had a little bit of touch there. This one had nothing unsterile down to the cuff. So these two hands are now sterile and can be utilized to interact with sterile surfaces or sterile fields. The parts where people mess up is in putting on that other hand. You want to make sure that you're not touching in any way that unsterile arm when you do it, and that you're not touching your sterile hand when you're putting your hand into the other glove. Those are the mistakes that people make. If you make that mistake, you got to start over, just put on another glove. That's the way you open sterile items, and that's the way you create a sterile working field that is sterile. Some last little points, things that I see, I catch myself doing, you don't want to do. If for whatever reason you think something unsterile touched something sterile, then you need to get rid of that item. Don't put it back on the tray. If I think my hands at all during a procedure brush something unsterile, then I need to change my gloves, because that little surface might be unsterile, might have bacteria that could get in the wound and cause a big problem. So if you at all think, oh man, this touched something, get rid of it off the tray, drop it right there, go change your gloves. If you think your gloves touched something unsterile, just back out, change your gloves, get sterile gloves back on, and go back. That's important. If you think at all something became non-sterile during a procedure that's supposed to be sterile, you need to fix that right away. These are all steps to make sure that everything we're using here and then using on a procedure that needs to be sterile on a patient stays that way. And it's really important. This is where infection comes from. Infection, 80% of the time, comes from us. 20% of the time, it comes from the patient. 80% of the time, it comes from a lack or a break in sterile technique. If we'll do this right, it keeps our infection rates very, very low.